If you're experiencing chronic or long-lasting fatigue, you might be wondering whether supplements can actually help. It's a really common question and a very important one. At the Optimum Health Clinic, supplements often form part of our nutritional therapy protocols. But it's vital to remember that supplements aren't a one-size-fits-all solution, especially in cases of complex fatigue. That's why we always recommend working with a qualified registered nutritional therapist, and this is because there are many important factors to consider when using supplements therapeutically. And it's necessary to consider all of these when we construct a supplement protocol. Now, these considerations include possible sensitivities to supplements, which is highly common in the fatigue community. And this is because immune systems in our clients are often already hypervigilant, so it's not uncommon for their immune system to have a problem with new things coming into the body. Therefore, supplement titration, how we introduce and adjust doses gradually, is really key. Supplement drug interactions are another essential consideration, as many of our clients arrive at clinic with medication protocols already in situ. Therefore, it's essential to consider any possible supplement drug interactions so that we can offer safe advice. Choosing the correct form of nutrient for each individual based on their therapeutic need is also key. Here we need to consider factors such as your methylation capacity, for example, which will determine how you're able to meaningfully use the nutrients in a supplement at a biochemical level. Your gastrointestinal health can also be crucial in assessing how you'll actually gain access to those nutrients provided by your supplements, along with other factors here, such as your hydration status and your cell membrane health. We also carefully consider the time and spacing of your supplement intake to avoid any supplement-supplement interactions and also interactions with your diet. And we work closely with you to manage any unexpected supplement reactions. So these are all important considerations, and they're central to building a supplement protocol that supports you both safely and effectively. Now, research into ME/CFS has shown some common nutrient deficiencies, including magnesium, B vitamins, vitamin D, and amino acids like carnitine and glutamine. But nutrients don't work in isolation. Taking one nutrient without considering its impact on others can actually cause deficiencies in other nutrients or even reduce the effectiveness of your protocol. We often speak with clients who, with the very best intentions, have put together their own supplement plans based on things that they've read online. But they often tell us that they saw no benefit, or worse still, they reacted negatively. That experience can be incredibly frustrating, and it's easy to conclude that supplements don't work. But in most cases, it's not about the supplements, it's about how they're used. That's why constructing an effective supplement protocol should always remain in the hands of a clinical practitioner. We'll help you to navigate it step by step, safely, strategically, and with your individual needs at the centre of everything we do. We're here to support your health journey, and supplements, when used correctly, can be a powerful part of that process. To find out more, do contact us to arrange a free discovery call.